The kidneys are located at the rear of the abdomen, one on each side of the lumbar vertebrae. The right kidney is next to the liver, and the left kidney touches the spleen. The renal veins from the kidney go into the inferior vena cava, as can be seen in this sectioned image. However, the renal arteries that come from the abdominal aorta and go into the kidney are not easily seen. Arteries are usually thinner than veins, so there are times they are not seen easily. The ureter that comes from the kidney can be seen. When you follow the ureter backwards, you can see the renal calyx and renal pelvis. In other words, the urine produced in the kidney passes through the renal calyx and renal pelvis and goes into the ureter. Then it goes straight down to the urinary bladder. The urine is now in the urinary bladder. The urinary bladder touches the rear part of the hip bone and is in front of the rectum. This cadaver is a male cadaver, so you can see the seminal vesicle between the rectum and the urinary bladder. The seminal vesicle does not fall under the urinary system, but falls under the reproductive system. Smooth muscle is placed around the walls of the urinary bladder and it contracts when urinating. See the urethra coming out of the urinary bladder. For males, the urethra that comes out of the urinary bladder passes the prostate. There is an illness that involves the prostate getting fat, classified as a reproductive system illness. When the prostate gets fat, it presses the urethra inside, so it becomes difficult to urinate. An operation to remove the obese prostate is performed. Also, for males, the urethra passes through the penis. The penis divides into two corpora cavernosa and a single corpus spongiosum. Among them, the urethra passes through the corpus spongiosum. There is one urethra, so there is only one corpus spongiosum.